I hear a lot of guys complain after going to their regular doctor to talk about starting testosterone therapy that that they don't have a good experience with it, that their doctor really doesn't know anything about testosterone, tells them they're normal and sends them on their way. And so then they complain. I hear it all the time. My doctor's an idiot. He doesn't know anything about testosterone. Listen, your doctor's not an idiot. Far from it. It's just that, quite frankly, you went to the wrong doctor, okay? What I mean by that is your doctor, who very likely has gone through conventional medical training, 4 years of medical school, and then at least 3 years of residency, they've had no exposure to health optimization or the concept of health optimization, certainly with hormones. They're trained to take care of really sick people. That's what I learned in my residencies. You take very sick, elderly people mostly, and the best that you can do, and this isn't a knock because this is important, the best you can do with those people is get them somewhere close to what's considered normal today. That's what your doctor's trained to do. So all day long, your doctor sees people with heart failure. If they're a regular primary care doctor, I'm assuming like family medicine or internal medicine, they see heart failure. They see diabetes all day long, kidney disease, coronary artery disease, high cholesterol, high blood pressure. They're managing all of these things in sick people. So when you come to them and you don't fall into one of these, little boxes of sick, or you have a medical diagnosis, they don't really know what to do with you. And that's okay, because that's not their job. Okay. The fact is you went to the wrong doctor. You chose a doctor in the wrong specialty. A good example of that is there's a reason you don't take your grandpa to the gynecologist, right? Gynecologists are physicians. They know a lot about medicine. They don't know much about taking care of grandpa. Okay, that's not their wheelhouse. So you intuitively, I'm sure most of you understand that you wouldn't do that. So if you're in a position where you're, quote, normal, but really you don't want to be normal, you want to be as healthy as possible, you want to get into that top 5% in terms of your overall health, you need to go see a physician who has a practice tailored to that, and who has taken the time to do additional training beyond residency to do that, because really that's the only way to get that kind of training. I had to pay a lot of money, and I continue to do that, to take courses on health optimization, testosterone therapy, all of those things that I do in my practice. So don't knock your primary care doctor. They're not idiots. They're actually very intelligent, and they're hardworking. The issue is you just went to the wrong doctor. Okay, so keep your primary care doc. They have their role, but go see somebody who has a practice that is more suited to your needs. So an age management physician, a men's health doctor who understands testosterone, that sort of thing. If you go there, you'll have a much better experience.
Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.